I'm gonna open my pack. So remember that you're gonna have a tag that tells you which is the front, and you're gonna open that accordingly. So you're gonna take your tape and you're gonna open your package, and if this fold is on top, you have to come over here and drop. And I think I'm gonna take this. Here we go. Oops. So you have a situation like this, go under and just try to encourage it back to where it needs to be, right? So then I'm gonna drop any additional items. So if I'm doing a left heart cath, I would drop my sheath on here, a wire if I need one, the manifold would be dropped on here, catheters would be dropped on here, any additional things that I need. Then I'm gonna go out and I'm gonna do my hand washing, and then I'm gonna go and look. So somebody can tie me up. How's that? That feels weird, but it feels good too. Because it's like, now the air's inward. I'm gonna have ice cubes instead of boots when I get done with this procedure.
Oh, and pay attention when you open your pack to how it is, because you're gonna reuse your packs, you're gonna do them over and over and over. So get used to putting your pack back together and kind of trying to fold it the way it was.
Do you want me to tie the bag?
Sure, tied up. So what would I have on? I would have on all
Bonnet,
of my,
mask, shoe covers.
Yep. So my doctor's gonna come in from this side. So you have to set everything up accordingly. And I put my gloves so that the doctor can see what size they are. This is an extra drape. All your doodads are in there. Don't throw things away. You don't know what's going to happen in the case, and you don't know if you're going to need them or not. So this is going to be my, I have a sheath and everything in here, so I'm going to show you all the things, right? Those are the ones I use. This. Sharps. Some 4x4s for that.
So her technique for the 4x4s was really good in a STEMI situation, because she just kind of laid hers out versus I folded mine. If I have time, I fold them, but if I don't, I just kind of flip-flop them so they can just grab a 4x4, because your doctor's going to need that tray of 4x4s. Those are your doctor's. And then I make one for myself, and I use the tag off of the, and I'll show you that later, I use the tag off of the cover.
I don't have a Lido syringe. I don't like that. They don't have a Lido syringe.
Oh, and I just put the other ones. I do want one.
Sure. Okay. So my table's set. So I put my doctor stuff over on this side, and I put the drape and the towels to the back. So these things are the biggest things. So I put those on the corners, and that way I have a field here. Oh, I need a Lido.
Oh, you need a syringe.
Syringe, yeah. She just added a shark to my food. And then I only put a towel down here if I'm doing a procedure where I know I'm going to be doing a lot of stuff on the back table. Thank you. But most of the time I would save my towels for other things, because 90% of your work is going to happen over here. It's not happening here, it's happening back there, right? So wire's already in the bowl. My Heparin saline would be in here. These bowls, these particular bowls, this is your wire bowl. Do you see those depressions? That's designed because when you go to get your wire out, you can scoop under the wire with your fingers, okay? And these little lips, the purpose of that lip is to keep the wire down.
So it doesn't spring out.
If you put a wire in a wire bowl, you don't have to tuck your tail. Tucking your tail is if you're gonna be laying the towel like this. But if you put it in the bucket, you don't wanna tuck it, you're just gonna make your loop and you're just gonna drop it in there and it'll stay below, right? So, and then if you're gonna be using the wire and you know you're about to pull it out, I would have this part in, and when I go to pull it, I just put my hand here and I can give it to the doctor. So he doesn't worry about, I don't have to take time holding the wire. I just give him the end and I just keep control of this end. You can't control a snake unless you're holding both ends. So you guys have to learn your technique for handling the wire. Do you want to hand me a catheter?
Mm-hmm.
Just any old catheter, I don't care. So when I pull my catheter, what I do is I keep all my catheters in the front of the table, and I don't take them off the card until I flush them. So I take the whole card when somebody presents me with a catheter. Some people will just pluck it and pull the catheter only. I don't pluck mine off until I flush them. And that way, if I'm doing a STEMI and somebody interrupts my flow, I know that that catheter is not flushed because it's still on the card. If I have 3 catheters, then I'll take those 3 ends in my hand and I'll flush, all 3 of them, and then I will take them off and loop them. If it's looped and it's on my table, I know it's flushed. Do you see what I'm saying? That's part of my routine, because I had a situation where I had a doctor come in and he thought he was helping me, and he took the catheter and started putting it in the patient. The catheter hadn't been flushed, so he put that catheter in there dry. Then when the wire came out, guess what? It was covered in clot. So I was like, I told you I wasn't done. I'm still setting up, and you pulled the catheter. So yes, it's on me, but he interrupted my flow. So I had to modify my process to ensure that that didn't happen again. And then going forward, if a doctor came in and he interrupted my process, I would be like, if the catheter is still on the card, it is not flushed. And they knew that. And I would make sure I told everybody that. So if you interrupt me, I know whether it's flushed or not. It's very important, right? Everything needs to have a fluid bath. So you're in the edges, you've got all your stuff. I think this is my edge here.
Yeah.
But see how this deal is centered? But once I open, you don't move it, you don't shift it, because anything that drops down is considered non-sterile, right? So, anybody have questions?
Can you go like over like this is the gown, this is what this bowl is used for, this is what?
Yeah. So you're gonna have, in every pack, you're usually gonna have 2 gowns. You won't have gloves, you have to drop those. So that's one of the things that you would have to add to your table. So standard equipment will come with the gowns and the towels, but not the gloves. So this is an add. You're generally gonna have a femoral drape. If you have to do a radial access and you need to add a drape for brachial or radial, you would need to add this drape. Towels are gonna come, band bag's gonna come, 4x4s are gonna come. So remember, you don't wanna dip, you wanna pour like Rachel did onto your 4x4s to wet them. When I do these and they're wet, I pull it up in the center and I just make piles with wet 4x4s. I don't fold them. It takes too much time. I don't do that.
You need a pile and your doctor needs a pile.
So I always have my 4x4s with fluid on the lid, so that, because if you take your 4x4s and you wet them and then you just throw them on the field, guess what's going to happen to all your fluid?
It's gonna seep in the towel.
It's going to get soaked up, right? So if you are doing that, what happens to your sterile field if your sterile field is wet?
Contaminated.
It's considered contaminated, right? So you're trying to avoid that. So save this piece of plastic, save the lid. If somebody hands you a sterile package and you can keep one of those pieces of plastic off of it, if it's sterile, use that. Do something.
This is perfect for yours because it's plastic. So I give this to my doctor. I set it on the patient's chest. I take this to the foot of the table. I put my 4x4s on here because this is, you'll feel it when you get yours open.
It's not water.
It's covered. Yeah.
Permeated.
permeable.
Permeable.
Yes,
Is that
it's
the
water
word?
repellent, so I set mine on here, and they're not soaked, so I'm okay to go at the foot of the patient because it'll hold my water.
Plus, you're saving your saline. So remember, your saline is heparinized. And if you keep doing that with your 4x4s, you're gonna soak up all your saline. It's gonna all be in the field, all over the patient's drape. It's all gonna be soaked up on your towels. So by this, you're salvaging that. You're keeping the 4x4s wet, and you're avoiding contaminating your field with moisture. Backstop bowls, that's for your safety. So when you go to fill your syringes, can I get a 20? I want to show them. So every single time you set up your table, this is what I want you to do. Your hands are not going to be strong enough when you first start these procedures. You don't have the dexterity in your hands yet. Y'all are using muscles you've not used in a way that you've never used them before, right? So every single time you set your table, this is what I want to see. I want you to take both syringes. Yeah.
I'll give you some fluid, maybe.
So
To the edge of the table,
Um,
or from here.
So every single time, I want you to take both hands and I want you to pump your syringes with those fingers to fill them. So pumping, what we're doing is I'm aspirating and then flushing forward, and I'm trying to reduce the amount of suction. And if you stay under and you pump, most of the time you're not gonna have any bubbles. I see one. So you're gonna flush. If you see a bubble, you're gonna make sure you get all the bubbles out, and then your syringe is full. You don't ever fill it completely. You wanna leave somewhere around 2.5 to 3 milliliters of fluid in them. Room to aspirate, because every time you use the syringe, most of the time what you're doing is you're gonna aspirate from the patient. But if you have it 100% full, the doctor's not gonna be able to aspirate. So what's he gonna do with that fluid? He's gonna do this number, and he's gonna squirt it out on the field. So don't waste it. Just give him 7 cc's of fluid. It only takes 2.5 cc's to flush a catheter. He doesn't need all that fluid. He just needs a little bit. So keep it partially empty.
So did everybody catch that different? The way Becca pumps hers, I don't pump mine. I go in the water, push out that air, and then I just come up. Or you can use hold it underwater and pump, whatever works for you to make sure your no bubbles.
But you should be able to do it with both hands, and you should be able to do it with a 20. And I'm going to tell you, it's a lot harder to do it with a 20 than a 10. So, but you need to be able to flush with both hands, because there's going to be a time when the doctor has you doing something and you need to give him a syringe, and you're going to have your hand on a wire and you can't move it. You've got to be able to do it with both hands. You need to be able to build that strength in both hands. You're going to get strength here because you're going to be using your right hand for your manifold. This, you really have to work on your left hand. So I want you all, the first time you fill up a bowl, I want you to take a 20 cc syringe and see how hard it is. That's what you need to be working on. If it's hard, then you know you need to work harder, right? So you should be able to do that. You should be able to fill a 20 cc without using both hands. Because this is what most people do. They're like, oh, that's hard. I'm gonna do it like this. Yeah, okay, that's fine if you got 2 hands. But what if you don't?
And practice with gloves on.
Yes, when y'all are doing your tables, y'all are gonna be using gloves.
And hat and mask.
Because you have to get used to the feel of the gloves. You have to understand that everything that you're going to be doing, you're going to be wearing these gloves, so you need to get used to doing that. It's a whole different. It's one thing to straighten out a wire if you're barehanded. It's a whole other thing if you're straightening out a wire when you're wearing gloves. I'm telling you, it's a whole different process. So this, y'all are going to have to work on too.
Let's pass the wire.
Yeah.
So they can practice. So,
Okay.
yeah, just kind of keep it in a loop, and then you guys can just pass it and work on squeezing that in. Try to straighten the wire. Just take it with your left hand, with your right hand.
So I recommend that you don't stick the sharp holder to the field, because you might have to move it during the procedure, and sometimes it can tear when you pull it up. Just tuck it in a corner somewhere so it's hidden out of the way.
It won't go out that straight. It
Have you ever
Alright.
had a lidocaine cup tip over it? If so, how do you?
I mean, if you do, you just get them to put you another, just say contamination
Backstop
and
bowl.
loss it.
This
So-
is a backstop bowl or a dump bowl or a waste bowl. It's known by a lot of terms.
So if
This
you
is
get-
what our quiz is about, right? The cath lab quiz.
So
Yeah.
Yes.
So if you get fluids on your drape, look what happens to the fluid. So what you're gonna
Yes, water
do?
repellent.
You got a wet 4x4s anyway, right? Just clean it up,
Add that to
throw
that
it to
one.
your pile. Okay. All right.
One thing I'd like to say, and I don't know if y'all heard my pacemaker story. Did I tell my pacemaker story to everybody? I don't think I did. So, it was the end of the day, and we were going to do a pacemaker, and I had already scrubbed like 5 or 6 cases. I was completely exhausted.
Yeah,
don't
you
have to
did
report
tell
it.
this story.
Did I tell everybody though? Everybody?